I know you've been told you have prostate cancer. I know you feel like your whole life is flashing before you. I know you're scared, and you know what? That's okay. Treating African American men has been a large part of my practice for over 15 years. This tape is a result of my years spent with patients, getting them through a series of difficult decisions resulting in a treatment choice and then often a full recovery. This tape, not by myself, isn't about me or any doctor telling you how to treat your cancer. It's a chance for you to hear from men who've been where you've yet to go, and with the support of their family and friends, they were able to make it.
The doctor said your PSA, your blood test, reveals that you have your prostate cancer patient. You know, devastating. Yeah. Didn't know what I didn't. There was no symptoms to say that that anything was wrong. I just didn't know. Yeah, I just didn't know.
You know, it's a shock when you find out you got cancer. So, but it wasn't so much of a shock to me in the sense that I've done a lot of studying. So I had already read up about prostate cancer a little bit before the doctor told me. So, but reading about it and having it is two different things.
So I went to see him, and he did the biopsy, and he was the one who called me and told me that they found the cancer. And actually, that was very devastating to hear that for the first time, because especially when you think you're healthy and you think that nothing's going on in your body, and then all of a sudden you find out that you have prostate cancer. Mm-hmm. And I was devastated. In fact, it scared me so at that on that phone call. I didn't want to tell my wife, but I knew I had to tell my wife, because I mean, we talk about everything. We talk about everything, you know.
So I came in. I think my three sisters were with me. And they showed us, you know. He said, "Well, you got three or four different, you know, choices you can do, you know." He said, "My advice to you, okay, is to do one of them, you know, and soon, you know, don't wait, you know, too long, because now the stage it's in now is early, you know, a real early stage, and we can really control it now in this stage, you know." But there was still one of those things where then I was okay, but when we left and went home, everybody went inside. I mean, because at that particular time in life, when cancer was one of the things where, you know, you're going to die. I mean, that's what you just feel, you know. I mean, you just start crying, you know.
Well, it's kind of like the empty feeling, you know. First thing you think that, you know, you're getting ready to die. That's the first thing you think about, or either you getting ready to go through some horrible treatment.
The ride home was my most depressing time. But after that, I'm gonna beat this. Yeah, that was my most depressing time. That hour and a half, so visits to the doctor and coming back home. Then we held hands at the table, talked to the Lord.
Why should you share the news? Who should you share the news with? The answer is you share the news because this isn't just about you. It affects everyone you love, and by sharing, you can get the support that will make all the difference. Who you share with is a matter of choice. Some men tell only their wife, and others make the whole treatment a family experience. All that really matters is that you get the support that you need.
Well, I think what really makes it so nice, you know, when everybody say, "Hey, we're here for you," you know, we all here for you, you know. If you need us, we're here for you, you know. And that's her, and you know, all the rest of my family too.
I just went in and told him. I said, "Baby, I just heard from the doctor, and he just told me that I had prostate cancer, you know." So I know it hit her pretty hard, and we just had to deal with it. But I mean, but I can say that maybe a lot of people who are married, we've been married a long time, and so a lot of people who are not married a long time might not have the confidence in each other that we do. We talk about everything, you know, and so it wasn't real hard for me to go and share this with her because I knew that Marilyn's is a take charge type, you know. You tell her she's ready to go right now, you know. But I mean that's good, and that's what when you live as one, those are the things that should be done.
There were three components I remember. Because of his faith in God, because of his faith in the doctors and the medicine, and his mental attitude, that I think was so strong that we didn't really feel the rippling effects of it. We were stunned, but because of the way he handled it, it kind of trickled down to us.
I didn't want them to feel that, to be afraid. Didn't want them to be afraid. Because I knew I was going to beat it.
So it was kind of wild, you know, sometimes when you tell people that you're sick, then they kind of don't want to come around you. You know, it's not that they don't love you or care about you, but it's just that they fear for themselves of what they got to go through. You know, it's like out of sight, out of mind kind of thing. So my brother and sister kind of shied away from me for a little while. But I wasn't worried about them because it was something that I was going to have to deal with anyway.
I mean, it certainly affected us.
Yeah.
And it certainly, I mean, we both had many times when we were very just quiet, thinking about what was going on, whether we talked about it or not. I started looking at everything that we did together in a whole different way. I mean, I started looking at just the things we did, like going to the market to shop together or going to the movies or whatever we did. I started just looking at it in a whole different way, like I've got to savor each one of these activities that we're involved in, each one of these moments, and really think about the life that we've had together up to this point, because I don't know how soon it's going to change.
Surgery, radiation, hormone therapy, the choice is a process that takes into account many factors. Health, age, the cancer itself. They all have an effect on what treatment you decide on. But it's important to remember that you make the choice. The treatment also includes the recovery and the time that it takes you to get back to your normal life. The decision is never easy. Once you've decided, pray on your decision, then sleep on it. And if you have peace with that decision, stay with it and don't look back.
I have done research on it before I was diagnosed with it, you know, because my father had prostate cancer. And when he had it, I did some research for him. So, and that was in 93. So now this is 99, 6 years later, you know. So I had already had some little bit of knowledge about it, you know. Matter of fact, when the doctor told me I had it and asked me to come to his office the next day, and he sit up and discussed my options with me, I was able to talk to him about it because I had already had some prior knowledge, which he was kind of surprised that I did, you know, of it, you know. But I didn't really go into it in depth like I did afterwards. He told me that I had, because once he told me I had it, I really started doing some research then. You know, I got information from different places over the internet. I sent off to Johns Hopkins to find out what their latest thing that they was doing on prostate cancer. I got information from the University of Iowa. I just sent all over everywhere. I got a briefcase full of stuff on prostate cancer.
You know, one of the hard things for me was that I wanted Billy to have the surgery. The more we were learning about the treatments for prostate cancer and the fact that it appeared as though Billy's was contained, in the prostate. And it seemed like the safest way, or at least I was connecting with the concept of surgery being the safest way. I know that, again, there are many people who look at it differently. But I felt like surgery was the right way for him to go. Billy didn't want to have surgery.
No.
That was a hard one for me. I had to just shut up and let him decide what he wanted to do. Because I had to remind myself that this was not my body, this is his body. And this decision is his decision. And there's nothing that is guaranteed that's going to work. I mean, I might be the one promoting the surgery. And so say he had the surgery and that didn't work out, and he did it because I wanted him to, I would feel horrible. I wanted him to go with the way that he felt best, because I also believe that your attitude is so important about how you heal. Your faith, your confidence that you're going to be all right, that plays such an important part in the whole healing process.
That's right.
So therefore, it was important that he go with the treatment that he felt was right for him. And I say that because I want to share that with wives who may have made it up in their minds how they'd like to see their husbands proceed, but they have to remember that it is his body.
A lot of the people that I work with, I told, because I know one guy I told, and he called me up and told me he got the same thing I got, He said, I had to call you up, because you were telling me back here in December, to go see this, Dr. Mason. But what happened was he went and saw somebody else, and he was taking a lot of pills and everything. And then when he went and saw a doctor, the doctor told him, these pills are not doing you any good at all. Then he got the biopsy, and they showed that he had cancer, And he's telling me, he said, well, I'm going to get the same thing you got. I said, well, I said, if you feel comfortable with it, you get it. Don't get it just because I got it. I said, you have to really be comfortable with it yourself. I said, because it's one of the things where you can't come back and say, well, you told me. I said, it'll be you and you alone that decides, what kind of treatment you're going to have.
The first doctor said that he was going to perform surgery, but it had spread from the prostate into the lymph nodes. So when I went to the second doctor, he said, well, look, if it had been contained in the prostate, removing the prostate would have removed the cancer. But since it's gone outside of the prostate, that's just unnecessary pain and expense. That won't solve the problem. He said, let's try something different.
A doctor that is a surgeon, naturally, he gonna recommend surgery. A doctor that's an oncologist, he gonna recommend radiation, So they always recommend whatever they do.
The knowledge of knowing, it said, like the Bible said, my people perish because of the lack of knowledge. And that's true, because a lot of times when we hear the word cancer, right away we scared to death because we don't know.
Right.
And when I found out that like Brianna said, it's not a death sentence, that we had time, that I could go on with my life, and even to know that I had another 10 years. Well, I know I'm not going to get out of here alive, but I do want the 10 years to be good years, to 20 years it could be. So it's not a death sentence. So we don't have to go nuts in our head or do this whole mind trip on ourselves about cancer, because it's something that's treatable.
The treatment is over, and your sights are set on getting back to living, but there can be some changes. Dealing with the changes is as important as getting the treatment in the first place. As you are on the road to recovery, it's often the moment you have time to think, why me? Why did I get this disease? Why did God do this to me? This is a question you can't answer alone.
I was already ready for it to be uncomfortable, But I wasn't worried about pain. My pain was gone because I was already told that I was going to be all right. So my pain was gone. And but the Dr. Holden had already told me, he said, Billy, he said, now, you know, you have to wear this catheter. And I want you to keep this in for 3 weeks. He said, a lot of guys, this is the most uncomfortable part. A lot of guys want this catheter out because it starts to irritate and it gets worrisome. And he said, but if you can bear it for 3 weeks, the better the chance you're going to have with all of this stuff healing and mending back together. So
And not being incontinent.
and not being incontinent and all these other complications.
But he gave me like I think a big old bottle of pain pills and all like that. I think I only took maybe 3 out of the whole box, and that was it. Because after that, I didn't have no more pain, and I never took any more. So I only took about 3, and that was it. Like I tell everybody, I said I didn't have that the pain you had, stuff like that. I said I didn't ever have that, What you talking about, bleeding and stuff like that? Hey, I never had that.
The only thing that I have with the prostate is that sometimes when I urinate, it's kind of hard to urinate, but that was to be expected. And then sometimes I urinate just normal. It seems like when I go to sleep and I wake up, when I first get up in the morning, it's hard to urinate. But once I go to walking my route and going through my motion, my everyday thing, then I can urinate just like anybody else. Sometimes it's what they call tight, sometimes it ain't.
I feel good. I feel, like I tell her all the time, she always asks, how you feel? I feel great. I do. I feel fine. With the cancer, hey, I feel great though. There's another thing too that I got to mention. Dr. Mason told me. Just like I'm sweating now, you have hot flashes. I mean, they come and they go just like a snap of a finger. I mean, but there's nothing for it because Vanessa, because Vanessa said she was trying to find out to have something to stop them too, but there's nothing that they got now that you really can, stop them with.
For the first 3 or 4 months, I was having normal sex. I mean, matter of fact, they had me on Cardua, which helps you urinate, and my sexual activity seemed to be better. Hey, I was doing fine. I was liking that medicine they had me on. I said, shoot, I like this. My lady friend, she you don't act like nothing wrong with you. But now, but I'm not totally impotent.
I don't feel any side effects. If my PSA and the doctor didn't say I had prostate cancer, I wouldn't believe I had it. I have no physical indications that I'm prostate cancer patient, other than the medication I got to take every day.
After you've gotten finished with the catheterization, then it takes time for your bladder to kick back in and start working again. So you have to wear those incontinent pads.
Yeah.
And
right.
we're on stage.
Yeah.
And Billy's got to wear these incontinent pads.
That was a difficult moment because a lot of times when you're doing things or you're exerting yourself, you have no control. So thank God you got the pad, so it's catching everything, and so and especially when you go for one of those high notes, you're gonna lose it, But thank God I was able to wear that. It didn't make that much of a difference in my appearance. Nobody knew it, but once I went on television and announced it to the world, well, I'm quite sure that there were a lot of men who came to see us perform, who had probably been through this surgery, who probably knew that I'm standing up there singing and jumping around on stage with this pad on. They know it and say, now how is he doing that? But only through the grace of God.
This video is not meant to be a substitute for talking to your doctor, your minister, or your family. It is a guide to help you get through a difficult time and aid you in making the best choices you can make. Many people care what happens to you, and sharing the process of getting well means that at a truly difficult moment in your life, you have the people who care most around you. That's when you can take a moment, look around, and appreciate what you do have and say, I'm not by myself.
What I would like to see most men do, what I would like to see all men do, is to make sure when they're having their physicals, to go and make sure that they have their PSA count checked. And that will determine if that's when they'll know if they have any problems at all with their prostate. And that's one of the things I would urge them to do every time they would have, even when they have a blood test, to have that checked, especially if they're in their 40s on up.
I think that for wives who are dealing with, or wives or mothers or sisters or whoever who are dealing with a loved one who has prostate cancer, that it's really important to encourage them to get as much information as they can. They need to deal with the fact that they have it, and to know that just because they hear the word cancer doesn't necessarily mean that they're getting ready to die. Because prostate cancer, when it's treated early, they have very good success rates. And I think that they should encourage their loved one with that knowledge, help them to get the information they need, and encourage them to go on and move quickly with getting it taken care of.
I'm one of the people that believe in God. I mean, you know, that's why if it's for me, it's for me. And what else can I do but go ahead and, you know, live with it? You know, if I take medication till I die for it, then I'll just take medication before I die. And I feel that he's not going to let me have any more than I can handle. So I just put it in his hand, and everything always works out fine when I do like that.
I'm a spiritual person, but I'm not the type of spiritual person that goes to church. I figure what's going to be. So I quit worrying about it. I just put it in his hand and just keep on going. And that's the way I am, you know.
When you try to rationalize, I said, well, look, sometimes good people have to face crises. It don't just happen to bad folks. Sometimes good. How you respond to it is something to consider, you know. And being depressed is a waste of time. You don't have too many years as it is. So, and I don't have any time to waste. This is why every day is a new adventure. Every day. I don't have any time to waste, you know, because you can't reach back and relive yesterday. Yeah. So I've been over really bad experiences. You know. After that initial introduction to prostate cancer, every day has been a ball.